But you really did.
We're logged in. We're logged into the Wi-Fi, correct? On both phones.
No, I'll do that though.
Let's do that because
It's okay.
We have 5 viewers.
Hi, 5 viewers. Hi.
Hi.
My ring light's not working, and I'm just worried that all my, flaws will show up. Oh my gosh.
It's okay.
I saw this picture
We can persevere.
of Kim Kardashian real skin and then Kim Kardashian airbrush skin. And I'm not knocking her because I have met Kim in person and she is beautiful. But the pictures side by side, I was like, this is why women feel so badly about themselves.
You've been lied to all these years.
Yeah, I mean, it was startling to see what it was. So anyway, I'm here with Dr. McNeill. I'm sure every one of you that's watching, I'm assuming that most of you know her. She's kind of the big boss. I'm sort of like the mini boss, and she's sort of the big boss at Newport Beach Dermatology and Plastic Surgery. So I'm Kerry. You're kicking it with Kerry right now. I'm the office manager, and I have no qualifications to be hosting my own little kicking it with Kerry show, except that I've been working with Dr. McNeill for the last 10 years. And I've actually known her. Kate, can you pop up that picture? I've actually known her for 30 years. I don't know.
Right.
I don't know how that's possible because we look so young and we look so good. But it's been 30 years, and look how cute we were. Did you see that picture?
I mean, we're and still are.
Well, we're still cute. We're still cute. But we were really cute back then. Do you guys see it? Is it up there?
I think we both have a good tan.
Yes, a good tan back in the day, and now we're just white because we need to protect ourselves from the sun. But today we're going to be talking about sort of like, I'm going to be honest. I kind of come up with these ideas probably like a month ago or 2 months ago, thinking that it's going to be great and I'm going to have all these things to talk about. But then literally this morning I go in to see Dr. McNeill and I'm like, what are we going to talk about?
What are we going to do?
So anyway, I still think we have some really good content. And what I thought we could talk about were some of the treatments that maybe we've been doing for a while, like 10 years.
The classics.
But then how they have changed and how we have changed how we use them, right? So it used to be just kind of like Botox, own the market. It was just a one-man show.
Put it right here.
Right here, what, like a triangle, like that? That's it. So, and now, how many do we have? I brought some. I brought them. We got,
of the toxins
we got this guy.
themselves?
We got Xeomin. We got Dysport. We got Juvederm, and they're, all in the market with this guy. And which I think also this is kind of funny because people say, I need to get some Botox. And really what they need is filler, but they don't know the difference between what filler does and what Botox does. And so anyway, I just thought I'd maybe just touch on that a little bit too. So there's these 4 guys. Why do we need 4 toxins, Dr. McNeill? Why?
Well, we probably don't need 4, to be honest with you, but I think evolving is good and working on new things and seeing if they're different at all is good. But whenever people ask me which one is best, that's a common question I'll get, which toxin is best. I think they're all good and used, when you know the different characteristics of the different ones, you can achieve sort of the same endpoints with almost all of them. So there's much more alike between them than there is, different between them. But they're all good. I use them all. We all use them all in the practice. Probably we use Botox the most because we're all very comfortable with it. But probably a close second. Well, probably a close second is either the Xeomin or the Juvederm. I'm not sure which. So I use them both.
And where do you use them now? We talked about this. You used to use it right here. And then that was great because all those lines smoothed out. Everybody's happy. Upper face. And now, gosh, you're putting that stuff everywhere. People's armpits, people's jaws, people's chins,
That's true. Botox has, and the toxins in general have a lot of functions. The primary one is to reduce muscular contraction. So if you block the muscular contraction anywhere, then the lines that start to form as a consequence of that over time will start to relax. And so that's why we use them primarily between the eyes and the glabella and of course across the forehead and around the eyes and the crow's feet. But then as time has gone on, we've realized there's other nice uses for them as well. I like to use them a lot in the platysma in the neck, because they all can kind of go like this, and this wrinkly kind of old lady neck can show when these platysma muscles start to thicken. So it's nice to kind of soften those. I like to use them in the masseter muscles, these muscles right here. Some people have a really round face, and people with a round face just don't like it at all. I think it's cute, but if you have a round face, you do not like it. It's funny. So they often want to slim their face. So one of the causes of a round face is just that this muscle here, the masseter muscle, starts to thicken, and that makes the whole face look rounder. So if you do Botox in there, you can just slim the low face, and it just makes it a more oval shape, which is
I didn't know that one until very recently. I thought that was only just to stop your teeth to the teeth grinding discomfort.
It'll hurt.
The narrowing, I want more there then. I want that, because I got a big old, anyway, beautiful round face.
It'll help with facial slimming with, a more oval face. And sometimes we do it in the little muscles right here, the DAO, the depressor anguli oris, which will bring up the corners of the mouth a little bit. We'll even do it as a lip flip in these muscles that are on the upper lip, and that'll give a little eversion of the upper lip. So you do it really drastically different in those ways. Like you would use 60 units in the masseter muscles, and you might use 4 units in the upper lip.
And that down, you say what you called it again right here again?
The DAO, the depressor anguli oris muscles. It's a muscle that goes from here to here, and kind of, as we age, the corners of the lips start to go like that. If you relax that muscle, they just go up just a little bit. And so it'll bring up the corners of the mouth if you relax or block the DAO.
Which is kind of huge for people that have that resting unhappy face. They have that just sort of downward they just don't look happy. And so to be able to kind of turn that, because usually those people actually aren't unhappy. They just look like they are. So I like that one a lot. I don't have that problem, but if I did, I'd definitely be getting a couple of units there. And then Jen did right here on my chin.
Yeah, that kind of pebbly chin, or people call it an orange peel
That's
look,
what she
or something
called it.
like that.
I didn't know I had it.
But she told you.
She told me I had it.
She's the best. So yeah, you could put a little Botox in there, and it'll relax that muscle. And then if it's starting to look pebbly at rest, then that's the time when you might want to put a little Botox in there, and it'll relax it, and then it'll just look more smooth.
Who knew? Did you guys know that? By the way, I do have 2 assistants that are helping us with questions. So if you have a question, please feel free to ask at any point in time during our presentation.
We did have one question.
We did have one question. Let's hear it.
Which is your favorite
neurotoxin? Yeah.
Which is my favorite? Well, I use Botox and Xeomin interchangeably, really. Like unit for unit, they work exactly the same. They both work, for about 3 to 4 months. They really work the same for me, but they spread the same, sort of everything's about the same. But some people who've been doing Botox for a while, it starts to just not work as well. They could develop antibodies to it, or it just starts to not work as well, and then we'll use the Xeomin. And so I've just started using Xeomin a lot more.
Because almost all of your patients have already had Botox for a long time.
Yeah. And so that's probably my favorite right now.
Okay. But if you talk to a different provider in our office, they might say something else, and it would be, you just said at the onset, they all work very well and can achieve the results that you're looking for, right?
Yeah, you might use more units, for example, of Dysport, but we all know how to use them in order to achieve the same endpoint.
Well, it's been the most surprising place that you've used Botox and been like, oh my gosh.
Well, recently I've been doing a trial, sort of like an experimental thing, which was kind of fun and actually worked out really well, to do Xeomin as we call like a hyperdilute sort of form for, because a thing that if you have it, you hate it, is enlarged pores. So if patients have enlarged pores, there's not really a lot of options for them. They can use Retin-A, but it kind of works, but it kind of doesn't. So another thing that these toxins will do in low amounts, really, is to shrink pore size. So I did like a we call it like a hyperdilute Xeomin, along with a really superficial Ulthera treatment, but a combination of the two treatments in the same day to reduce pore size. And that worked really, really, really well.
Really?
Really well. So that's sort of like a new use of these toxins for me that is very effective. And then, you know, now I've just seen some of those patients back at a few months later and it's still hanging in there very well. And I really didn't use that much toxin at all. So so I'm really happy with that result.
But it's a lot of injections, right?
It's a lot of injections.
They're micro injections, right?
Every 5 to 6 millimeters across the area that you want to treat. So in general, where people get their enlarged pores is kind of like this central facial area. So it's really tons of little tiny
Do you do it on
injections
their
along the
nose
whole
too?
area. Yes, on the nose.
That has to hurt.
Well, they've just had their Ulthera treatment, so we get them
So
really
they're already
nice
in pain.
and numb. Well, we get them really nice and numb.
Okay.
They get their Ulthera. We give them some kind of medication to be comfy and
Yes.
things, and then they get their Ulthera, and then we finish that off with the either micro Botox or hyperdilute Xeomin, and then it just kicks in.
See, so
Tightens the pores.
when Dr. McNeill and I kind of had a literally 2-minute talk this morning before you had a patient about what we might talk about, these things, there's actually so many little things that are happening all the time that are new that we kind of don't even realize. It's kind of like you don't realize it until it comes up like that. So just an interesting little point to make. Now let's get into the fillers.
Okay.
So when I first started, filler, I think Juvederm was the only guy around. Maybe not.
No, they had Restylane.
They did have
Juvederm
Restylane.
and like regular Restylane.
Okay,
Yeah.
Restylane L.
L.
Right. And they would just put it right here. Right.
And sometimes on the lips if we were getting crazy.
Crazy town. Okay, and then over the course of the last couple of years, there's been, FDA approvals, but even before the FDA approvals, people are using it off-label, right? So what do you think has been the most interesting way to use filler, and tell me some of the ways that you're using it in the office on a regular basis?
Well, what you brought up, treating the nasolabial folds was certainly very popular and still is. We still do that sometimes, but in general, we actually sort of steer away from doing too much filler in the nasolabial folds and the lips. We try to sort of change the structure of the face. So if you have a heavy nasolabial fold in general, it's because you've got sort of a lot of skin kind of hanging down this way, which makes the nasolabial folds more prominent. So now we're trying to sort of bring that back, with filler and enhancing people's natural, sort of facial features by enhancing the cheekbone, the zygomatic arch with a little bit of filler, enhancing their natural jawline, maybe with a little filler to make that more prominent, so that we're not kind of putting too much filler in the central face, which can look sometimes a little puffy or unnatural if too much is put there. A little bit can be fine, but in general, we're trying to sort of create, enhance people's natural features that are already there.
And one of the places I've found to be very interesting is this, building up of the chin and the jawline. Structurally, how the thickness of the fillers and, where you can put them in the looks you can achieve, it's really remarkable.
Yeah, it's really interesting how the fillers have lots of, properties about all of them that are sort of slightly different, but we talk about the G prime or the thickness of the filler being something that can change the actual sort of structure of the face. So the higher G prime or the higher viscosity or thickness of the fillers, we can, sort of build up the chin, sort of build up the jawline, and that can really enhance somebody's facial features. The ones that we use the most for that jawline or chin, like what you're talking about, are the Restylane Lift or the RHA 3 or 4. Those are hyaluronic acid fillers that can really sort of change the structure of the face.
Can everyone see the fillers in the shot or no?
Probably.
Because I brought, these are kind of the OGs. And then let's see, I don't have my glasses on. This is the OG, right? So the original gang over here. And then now we've got
RHA 3.
This one's pretty new to me. I mean, I think we've been carrying it in the office for about a year.
Yeah, I think
and
so.
it's like marketed as like the designer filler. And why is that? What makes it designer?
The Revance fillers are sort of designed to sort of move with your face. So if you have the filler in your cheek, as you smile, it sort of moves with you, and it doesn't look like sort of stuck in
it's just
one
sitting
place,
there.
like it's just sitting there, like you might have seen sometimes. So the fillers give a very sort of natural look, but still enhancing your natural features. And then they have sort of a family. We've got a couple of them here, but there's another one too called RHA4. So these fillers sort of go from like a nice sort of thin where you might do the RHA2 in sort of the lips or around the eyes to sort of a more thick and give more, almost mimic bone, like, give more structure to the face. And so those are a really nice family of fillers that we use, and they're also very long lasting. They'll last generally more than a year, even close to 2 years. So people are really happy with these RHA fillers. And this company is also going to be coming out with that new longer lasting toxin that's probably going to last twice as long as Botox or any of the other toxins that we have right now. So that'll be exciting also from this company, Revance.
Did you guys hear that? You won't have to come and see me every 3 months. You will maybe be able to last a little bit longer, like 6 months, Dr. McNeill?
That's what I say, 6 months, yeah.
6 months. Does that mean that we're going to go out of business?
Well, we'll see how they price the product. We don't know how that's going to be, but no, we won't go out of business.
And
just
then,
more to do.
So we talked about
more
this,
opportunity.
the Teoxane, and then we've got the Restylane family of products, which includes Kiss and Refine and Define and Lift. Looks like I missed one.
Oh, we have a good question. Someone who just turned 50, never had anything done.
What?
Where would you recommend them to start?
A consultation.
That's a good answer.
Consultation.
A consultation's a good point. Because everybody's so different.
So different.
Some people are 50 and they really don't have any etched in lines at all, or very few. And then some people have tons of them, and then some people are like totally covered in little brown spots that can, make them look older or whatever. So consultation is very important. And then, it also depends on what's bothering, what bothers them, what bugs me, it might not be what bugs them. So it's really a conversation when we decide, what to do. But we want to, obviously achieve the patient's goals. And some people really don't know. Like some people come in and just say, I don't know, what do you think? And that's fine. If you say, I don't know, what do you think? I'm happy to give my opinion. But the most important thing for me is to make sure the patient's happy. So I always want to hear what they notice, or what's bugging them when they look in the mirror, because generally there's things we can do to help.
Right. So it may not be as simple as, oh, you need a Botox, or oh, you need a filler. It might be, well, let's tackle this skin issue first. Maybe you have some pigment. Maybe you have these other problems that we could look at first, and then. But we have something for everything. Like we really do like cover the gamut. We've talked a little bit about fillers, but when I say we have everything, we can even rejuvenate your private parts. Did you guys know this? We have something called Intima, Core Intima, and it's laser resurfacing for the interior and exterior of the vulva, and it can help with incontinence, which is awkward, a bit, and it can help with dryness, and it can help with appearance.
Yeah.
And make, your sexual health more comfortable.
That's absolutely true. It's a laser treatment. It's a fractionated CO2 treatment with sort of parameters that are adjusted to the vaginal wall, so internal, the vagina, and also the vulva, so the external skin, and really just makes it more healthy, sort of restores it to where it was before, increases cell turnover and makes the cells more healthy. So yes, improves lubrication, just improves dryness, the cosmetic appearance, because it tightens the skin as well. And then after many treatments, improvements in stress incontinence as well. So it's really sort of a a very progressive treatment for sure for the vulva and vagina or vaginal tissues. And we do it for people who are going through what we call genitourinary syndrome of menopause, so just like the changes that happen with normal menopause. And then also for certain people with certain like vulvar skin diseases, so we do it for medical reasons and sort of just like general anti-aging reasons. But it's very successful. I mean, I literally have had no patients unhappy ever.
And not that uncomfortable. I mean, it kind of sounds like it would be horrible and scary, but it's really not. I can speak from experience. I've had it.
Yeah, that's actually one of the questions. How painful is it?
It's not painful.
It's
and
not.
You'd think it would be because it's laser in that area, but there's two reasons it's not painful. One, we do a good numbing cream that's really, really strong, but also, if I put that same numbing cream on your face, it wouldn't work as well. Down there, it's these mucosal surfaces that absorb this numbing cream very well. So any numbing cream you put down there is going to be like 20 times more effective than it would be if it was on like your arm or your face. So that area gets very, very numb with just putting this topical cream on there. And then, I can kind of do my thing and you might feel it, but it's really not painful. Mm-hmm. And you do it generally 3 sessions, and then, you have a very nice result. Even from one treatment, most people have a nice improvement in dryness.
And I'm happy to bring it up in this sort of context because it's sadly something that people don't ask about, and it can make a huge difference in how you feel about yourself and how how you feel about your husband and all sorts of things that like are important to life. And so is this whole month about women?
It's something about like women's something
the
month.
downtime?
There's not much downtime at all. For a week after the treatment, you don't put anything in the vagina. So you're not sexually active, no tampon, no douching, just nothing in there. And then you wouldn't do like a hot tub or at the ocean or somewhere where something could get infected. That's the only real restrictions for 1 week afterwards. But really just for that week, it looks a little swollen but subtle, maybe a little itchy, but all of those things are very subtle. It's not anything that you're not in pain afterwards. Once it's done, it's over and you kind of forget in general that it was done.
It's all about the Aquaphor afterward.
You just put on Aquaphor.
Aquaphor. Mm-hmm. Aquaphor. So that's an interesting, treatment. I said we have kind of something for everyone. What's your kind of most fun treatment at the office that you enjoy doing, but maybe also doing, like having done to you?
I think that's a good question.
I stumped you.
I think I enjoy doing the CO2 resurfacing the most.
Like the provider performing the treatment?
Me performing CO2 resurfacing, because I know that the patient's going to get a good result, first of all, and that sort of like a very sort of long-term, like it's healthy for your skin in general. Long-term, you're going to have smoother skin and, more even and less lines and less brown spots and all of that stuff. So I think overall that's like, I'm always happy when somebody decides to do a CO2 because I know it'll be good for them in the long run.
I don't want to interrupt you, but I'm going to interrupt you. You were saying CO2, kind of assuming that they know what you're talking about.
Yeah,
so what's CO2?
CO2 is the laser resurfacing, the fractionated CO2, or we'll call it CORE sometimes because it's CO2-RE is the brand name of the laser that we use. But it's a fractionated CO2 treatment. Stimulates, it's actually ablative to the skin. So there is a definite amount of downtime with this procedure. Generally, it's about a week, and then you're looking good. And stimulates new collagen, basically smooths fine lines and wrinkles and brown spots and tightens the skin. So just sort of gives an all-over skin rejuvenation.
I've done that one too. I really like that one
Me too.
Yeah, that's a good one.
Yeah.
So that's what you like to perform. What do you like to have done?
And I would say that in the last, year or so, we've certainly done probably as many as we did in the previous 5 or 10 years,
gosh,
just because
so
everybody's
true.
home. So
Yeah.
having time to recover. A lot of people who've wanted to do that procedure for a long time but couldn't carve out the time. So So that's been good. I've been having lots of fun doing that procedure.
Yes.
And then what was the other question?
What you like to have done to you?
I like to get the True Sculpt done, the muscle stimulation treatment. You want to plug our True Sculpt.
Oh yeah, we got a program.
coming
We're doing a challenge coming up. So Dr. McNeill is very fit. She always has been. From the picture that you saw, at the start of the show, she's always been thin, and she's always been a worker outer, like a runner, hardcore runner, and now she's, into doing all these muscle building workouts.
You did it.
I did it too. And she got to a point where I think you reached a little bit of a plateau with your workout, right? And then is that why you bought the machine? No, just
yeah, let's be honest. I bought it for me personally
no,
too.
So this machine is called True Sculpt Flex, and it helps to build muscle, and you get it goes through different types of workouts. It twists, it stretches, it strengthens, and when you do this program, this series of 6 treatments, you can increase your muscle mass and get a little bit toned. Be stronger, yeah.
It looks better, but you are stronger also. So it's pretty powerful. It kind of gets you over any hump in your workout for sure, but then, just allows you to be stronger than you could have been on your own.
And Dr. McNeill was saying, I did it last June. We did a program where we had, I think, how many people ended up doing? Like 16 people?
Yeah,
16 participants we all did the program together, and we did it in conjunction with this workout, which was 4 days a week, called Lift 4. And we measured our strength gains over the course of a 12-week period, and we have some excellent results. I think there might be some up. Oh, Kate's already got them on there. So we're going to be doing this program again starting April 1st. We're breaking it up into 2 different groups. One starting April 1st that will go till May 15th, and then we'll have another one start right at May 15th and go through, July 1st. And you will combine the programs. We'll have 2 team leaders. I think Dr. Lamer might do a team, and Jennifer Moeller might do a team. And then I'm
gonna and Jennifer.
You're gonna do.
I'm gonna lead a team, and Jennifer's gonna lead a team.
Oh, okay. Dr. McNeill and Jennifer are gonna lead teams. So if you're interested in this program, we're offering it at a discounted rate. It's $2,000. It's really cool because you can also be with, kind of going through the process with some other people that are like-minded and experiencing the same thing. Mm-hmm. The results that we had last time, she's just got some, I think 2 pictures up there, but everyone had good results.
Yeah, and we tabulated so there's some pictures, which is cool. You look stronger for sure, but you actually are stronger. We measured the strength gains, and in lots of the categories, there was more than 100% improvement. At the end, people could lift double what they could lift at the beginning in terms of, all these exercises, lunges and sit-ups and, their biceps and everything. So huge increases in strength and also just sort of physical appearance. So it was really fun to do it together with get to know some of our patients better too. Mm-hmm, and then, fun to sort of challenge each other and keep in touch. Kept in touch over a little Facebook private Facebook group, and it's fun. And
there was a few patients that really became much more active in the practice after. It's cute. Mm-hmm. It's nice to see. We like our patients. Mm-hmm. We're so grateful for all of you, and the fact that you've kind of stuck with us and continued to support us, and the fact that you're sitting watching this right now. I mean, thank you very much for being interested in this, and we're happy to answer any questions you might have. I see Kybella sitting over here, and I know we had one picture of a gentleman who had used Kybella. He maybe had done a combination of Kybella and cool sculpting, or did he just do?
I think both. Mm-hmm.
Okay, so a trouble spot for many people is this chin, and in the dermatology field, we have a couple solutions. We can do cool sculpting on your chin, which is another body contouring device that we have in our practice. We have 2 cool sculpting machines that we can use in conjunction with True Sculpt, which is a really great combination for a lot of people. But for this chin area, sometimes people might use Kybella, which is another injectable by Allergan.
Just a little vial you can inject into the skin. It dissolves fat. You can inject it anywhere, but it's FDA approved in the submentum, so the area, sort of under your chin, and it truly dissolves fat. It's pretty remarkable.
It's real. So when you got into dermatology and you were thinking, kind of what your day might look like and what your day has become, how different is it?
Well, it's very different. We didn't have so many devices, so much technology. And there were some, and that was a lot of what attracted me to derm. But now it's just sort of exploded, Most of the devices were either to treat like little broken capillaries in the skin, or brown spots for sure, but not things that would completely change your skin or be able to tighten the skin without, completely making it raw for, 2 months. So a lot more ways that you can improve the skin without, having so much downtime.
You mentioned the broken capillaries, and I just want to touch on that because it used to be that we would just do, IPL for sort of rosacea treatment, and now we have that XLV laser, which really, really improves redness and broken capillaries with very little downtime, and it's a kind of success that you didn't see as prominently as as before with the IPL. Do you want to talk about the XLV a little bit?
Well, XLV, we brought on, it has sort of a lot of functions. It can even treat those sort of like purple sort of veins that people get, under the eyes. It can treat certainly just like redness, diffuse facial redness or just little broken capillaries. Little angiomas on the body, all the little red spots that bug people so much. And it can activate our sebaceous treatments for acne, for active acne, our laser treatment for active acne. So it has a lot of functions in our practice, but it's been very, very reliable, very successful.
Yeah. Well, I know it's Friday night, and many people have things to do. Oh, do we have a question?
Yes.
Oh, we have a question.
What's the difference between CO2 laser and pico laser?
That's a good question. Pico is one that can be used sort of for tattoo removal, but in general for anti-aging, Pico is a non-ablative laser, so has very little downtime, but will also achieve those same endpoints of like skin tightening and improving brown spots and things like that. But you do sort of like a series of Pico treatments, maybe 4 to 6 Pico treatments to get sort of the results from one CO2 laser. So CO2 is more ablative, has more downtime, but you can kind of get it done in one treatment.
One and done.
Yeah.
Pico's more for the people that just don't want to have any downtime. They want to do it at lunch and they want to go back to work.
Mm-hmm. And you look fine. You're a little pink, but you'd be fine to go back to work, do your normal things that day and night and the next day.
Yeah.
Yeah.
So that's a really good question. If anybody has any other questions, we're happy to take them. I want to mention that next week, I think right after work, maybe like 5 or 5:30, probably 5:30 on Thursday, I'm going to sit down with Dr. McNeill and Dr. Elstrom in our office, and we're going to kind of do like the battle of the specialties, like we talked a little bit about Kybella right now and how it can help with, submental chin fat, but maybe Dr. Elstrom might say, no, lipo is the way to go. So we're going to kind of talk through some different problem things that people are talking about, and then what solutions dermatology might offer, and then what solutions plastic surgery might offer. So that'll be Thursday.
Cool sculpting's way better for the submentum.
See, she's getting all competitive. Yeah. And I just wanted to, this was on Jennifer's desk. She and I are, office mates. And I saw it. I was like, what a pretty, colorful magazine, right? The cover. I was like, wow, that's quite. I wonder why that's on Jen's desk. Is it because it's so cool looking?
She's so Hollywood.
And then I saw this tab, and I was being nosy.
You just went on Jen's desk and opened it up.
Well, we share. And then I saw this, and I was like, excuse me, that's my office, and that's Dr. McNeill right there. And then there's these beautiful women. We're talking about all of our stuff. Yes, that's on Vanity Fair, people. Did you ever think that you'd have an ad in Vanity Fair?
I think the next ad needs to be about kicking it with Kerry. What do you think?
Should we do an ad on kicking it with Kerry? I don't know. I just think that's really cool. You're so big time.
Big fan. I like it.
Yeah.
Hollywood issue.
Hollywood issue.
Don't miss it.
So please join us next Thursday. We'll be meeting in the office, and then let us know what other topics you'd like to discuss. I've got some ideas, but I always like to hear from you guys. And throw us a like, and
Jess?
share with your friends. And thanks so much for joining us. Have a great weekend.
Thank you.